Hello everyone, welcome to our talk. Today, we discuss gonorrhea. It is a common infection. Some people know it as the clap. Bacteria cause this sickness. These bacteria are very small germs. You cannot see them easily. They can make your body unwell. These bacteria are like tiny seeds. They can grow inside your body. They prefer warm and moist areas. This includes your private parts. Gonorrhea can make you feel sick. It can cause discomfort and pain. Knowing about it is very important. This knowledge helps you protect yourself. Many people can get gonorrhea, so there is no need for shame. It is important to learn about it. It is like other infections from germs, but this one spreads in a specific way. We will learn how it moves. This understanding is key to prevention. Let us learn together now. Gonorrhea often affects the private parts. This means the penis or vagina, but it can also affect your throat. Sometimes it infects the eyes. This happens less often, but it can. It is good to know all this. This information helps you stay safe and helps you recognize signs. How does gonorrhea spread around? It passes during sexual contact. This means when people have sex. It can be vaginal sex. It can be anal sex through the backside. It can also be oral sex. Any of these can pass the germs, so it is a sexually transmitted infection. Think of it like passing a secret. The secret is the gonorrhea bacteria. It needs close, intimate contact to pass. The bacteria move from one person, they move to another person then. This happens during sexual activities. Without protection, the risk is high. It does not travel through air. You can get it quite easily. It does not always need ejaculation or cum. The bacteria can be in pre-ejaculate fluid, or in vaginal fluids always. Just the skin-to-skin genital contact can be enough, or contact with infected fluids, so using protection is very smart. We will talk more about this. A pregnant mother can also pass it. She can pass it to her baby. This usually happens during childbirth as the baby passes through the birth canal. This can cause serious eye infections or other health problems for the baby. So, pregnant women need testing. This protects the mother and child. For men, watch for certain signs. Pain when peeing is common. It might feel like burning, like pepper. A discharge can come from the penis. This drip might be white or yellow, or sometimes it looks greenish. Testicles might also swell up, or they could feel painful. Women also have signs to look for. Pain during urination is possible. They might see more vaginal discharge. This discharge may be unusual. It could have a different smell or color. Some women bleed between their periods. Pain in the lower belly can occur. These are important warning signals. Gonorrhea can show up elsewhere. A sore throat can be a sign. This can happen from oral sex, if the infection is in the rectum. You might feel itching or soreness there. There could be discharge or bleeding. Painful bowel movements are possible too. Listen carefully to your body. This is very, very important now. Some people show no signs at all. They feel perfectly healthy and fine, but they can still have gonorrhea, and they can pass it to others. This is why it is called a silent infection sometimes. Regular testing is therefore very wise, even if you feel no different. Section 4. Taking action. Why seeing a doctor and treatment matter.
If you notice any of these signs, or if your partner has gonorrhea, please go to a doctor quickly or visit a health clinic soon.
Do not try to treat it yourself. Using local herbs or old medicines is risky. It might not work or cause harm. Always seek professional medical advice.
The doctor or nurse will help you. They know how to check for gonorrhea. They will do a simple test. It could be a urine sample test, or they might use a soft swab to take a sample from the area. This helps them find the bacteria. The tests are usually not painful.
Gonorrhea can be cured with medicine. Doctors prescribe special drugs called antibiotics. These medicines will kill the bacteria. You must take all the medicine given. Finish the entire course as directed, even if you start feeling better fast. This ensures all germs are gone, like finishing malaria drugs properly.
If gonorrhea is not treated well, it can lead to serious problems later. For men, it can cause infertility. This means difficulty making a baby. For women, it can cause PID. This is pelvic inflammatory disease. It can also block tubes, causing pain and make it hard to get pregnant.
Section 5. Protecting yourself and others. Ways to prevent gonorrhea.
How can you prevent getting gonorrhea? Use condoms every single time you have any type of sex. Condoms act like a barrier or shield. They block the bacteria from spreading. Learn to use them correctly always, from the start to the very end. This is a very effective method.
Get regular checkups for STIs. This includes testing for gonorrhea. especially if you have a new partner, or if you have more than one partner. Knowing your health status is good. Encourage your partners to test too. Open and honest talk is important. It builds trust and safety.
Limiting your number of sexual partners. This can also reduce your risk. Fewer partners mean fewer chances. Fewer chances to meet the infection. Think about your choices carefully. Your sexual health is very valuable. Protect it with wise decisions daily. It is part of your overall well-being.
Your health is your greatest wealth. Taking these steps is very smart. It shows you care for yourself, and you care for your community. Do not be afraid to ask questions. Seek information from trusted health workers. Stay informed, stay safe, stay healthy. You can take charge of your health.